treatment, at least on regular basis, 2 to 3 months. And also let your care provider evaluate and also explain the results, the outcome of your weight and your BMI to you.
What are the dietary requirements for a person living with HIV?
A person living with HIV and AIDS requires also to eat a balanced diet, just like even a person who is not HIV positive. You require at least to eat 3 main meals in a day. That is breakfast, lunch, and supper, at least 3 times in a day if you can afford, and also the in-between snacks, energy-dense snacks. And by a balanced diet, I mean at least your meals have to contain a carbohydrate, a protein, and a vitamin. And also together with the balanced diet, you require also to have a regular physical activity to maintain, to achieve an ideal body weight and also to maintain a healthy life.
Is physical exercise important?
Physical exercise is important, is also necessary to strengthen your body muscles, also to enhance immunity, and also to maintain an ideal weight.
How much water should one take?
You also need to take at least 6 to 8 glasses of clean and safe water. That is equivalent to 1.5 to 2 liters of clean and safe water per day.
How does one prevent mother-to-child transmission?
There are 2 feeding options for infants in prevention of mother-to-child transmission. One is exclusive breastfeeding, and another one is called exclusive replacement feeding. When I say exclusive breastfeeding, it means you're giving only breast milk for at least the first 6 months, and nothing else, no any other fluid, no water, no any other drink. It's just the breast milk and maybe the medication that the baby is given at the hospital. When I also talk of exclusive replacement feeding, you're only giving animal milk, commonly cow's milk, and maybe commercial formulas for the people who can afford to buy, at least for the first 6 months alone. When you talk about exclusive replacement feeding, it carries no risk of HIV transmitting to the baby, but again, it poses a very high risk of death to the baby because of other infections like pneumonia, diarrhea, and other infections. So if you compare the two, actually breastfeeding is the safest. It is the best both for the baby and the mother, and it also has long-term benefits for the baby, and as long as you're doing it the right way, and it should be always exclusive breastfeeding, at least for the first 6 months. Before you choose which way is which feeding option to take, it's good that you consider your family situation. At least make sure that whatever you're choosing, it is acceptable to the community at large, and even to your own family members, so that they support you. You do you practice whatever method you have chosen comfortably, so that maybe you're not forced to mix feed before the 6 months. You're supposed also to look at your affordability of the method that you have chosen, so that at least you can sustain it for the first 6 months. Look also at the for the safety, for the sake of the health of your baby. Look at the environment, the home environment where you live. Is it do you have access to a clean latrine or toilet? Do you have access to safe drinking water, or a healthcare facility?
Can a mother pass on HIV to her baby through breast milk?
When a mother is breastfeeding, you should always remember that as long as you're breastfeeding, it carries a risk of, your baby is exposed to HIV. So when you do it, it should be exclusive, at least for the first 6 months. And also during breastfeeding, where the risk is also high, whereby maybe you have just been newly infected with HIV, or maybe you have a breast infection, especially the nipples, and maybe if the baby has mouth sores. So as long as you're breastfeeding, you should also check the status of your nipples frequently, and also that just to ensure that the baby has no mouth sores.
What are the nutritional challenges facing HIV-positive patients?
The main challenge that has been there in my experience working with in a HIV setup, it has been that most mothers, the way it has been before, I think people have been brainwashed. They have been meant to believe that you're not supposed to breastfeed because you're HIV positive. If that happens, automatically your baby is infected with HIV. But so the challenge has been to try and change their mind towards to know the right thing. But again, they are picking up slowly when they see that maybe their friends have done it and the outcome has been good. But again, that is still a challenge to some people.
My name is Martin Mudare. I'm a clinician working in the HIV care and treatment department.
What is AIDS?
AIDS is a short form for acquired immune deficiency syndrome, and it's a serious condition that results from the body's defense system being destroyed by human immunodeficiency virus. That's HIV.
What is HIV?
HIV is also a short form for human immunodeficiency virus. It's a virus that affects the body's defense system, causing serious condition that we have said that's called AIDS.
Who gets HIV?
Anybody can get AIDS, especially mostly when one who is infected has unprotected sex with an uninfected person.
How is HIV transmitted from one person to another?
HIV can be passed from one person to another through body's fluids like seminal fluids, vaginal fluids, breast milk, and blood.
What are the main routes of HIV transmission?
The main routes of HIV transmission include having unprotected penetrative sex with someone who is infected. You can also get HIV through injection or transfusion with contaminated blood or blood products. Also sharing contaminated sharp objects like razor blades, needles, and with an infected person. It can also be passed from a mother who is infected to her baby during pregnancy, at birth, or through breastfeeding. And as I said, sharing unsterilized injection equipments that has been previously used by someone who is infected.
What are some of the services provided at Care Clinic?
We provide a wide number of services through our 2 HIV care clinics, that is in Hurlingham and Tivoli in Kisumu. These services include provision of antiretroviral therapy. We also do lab monitoring of HIV. We provide nutritional counseling and support. We do diagnosis and treatment for STIs, screen for TB, and provide treatment, screening and treatment of those opportunistic infections. We also provide psychological support, which includes general counseling and support group, and also adherence counseling. We provide also post-exposure prophylaxis for health workers and survivors of sexual violence, diagnosis and treatment for STIs, that's sexually transmitted infections. The other services that we provide include prevention with positives and reproductive health services, which include family planning.
What is TB?
TB is an infectious disease that is spread from one person to the other, mostly through air droplets, which occur through coughing. Some of the symptoms of TB include feeling weak, weight loss, and fever. And as you know, TB can affect any place of any part of the body. If it has affected the lungs, then there will be cough and chest pains. Then for the other parts of the body, any part of the body, then the symptoms will vary.
How do you diagnose TB?
We do diagnose TB through screening, and in this we do ask questions that are specific and suggestive of TB. And then if someone scores, if you do score any of those questions, then we carry out some diagnostic tests that include sputum test. That is the sputum, the kikohozi is sent for testing to detect whether there are TB bacteria. And then the other diagnostic tests that we carry out include X-ray.
Is TB curable?
TB treatment is done for 6 to 8 months. And after TB, patients have taken their treatment for at least 2 weeks, then they cannot transmit TB. Yeah, so TB is curable.
What are STIs?
STI stands for sexually transmitted infections. They are also called STDs, sexually transmitted diseases. They are passed from one person to the other through sexual contact, and most of them they do not show symptoms, and some will show symptoms. Having an STI can put you at great risk of acquiring or transmitting HIV. Therefore, patients are advised to regularly go for clinic to be screened for those STIs. And if one experiences any symptom suggestive of STI, then they should seek prompt treatment from the clinic. And STIs can be prevented through abstinence from sexual activity, being faithful to one partner, and also use of condoms correctly and every time one has sex.
For any other related concerns on the subjects featured, please visit the nearest health facility.